A woman, 52 years old, first consultation on March 11, 1999. Chief complaint. For nearly 10 years, she had recurrent nasal congestion with turbid nasal discharge, accompanied by reduced sense of smell, dizziness, and distending headache. Previous treatments had no effect. The condition worsened whenever she caught cold or became fatigued. Half a month before consultation, exposure to cold caused a relapse of the old illness. She developed nasal obstruction with thick, yellow, turbid discharge and distending pain in the forehead. The symptoms became worse when opening the eyes or bending forward, and were especially severe in the afternoon. Accompanied by dizziness, tinnitus, aversion to cold, fatigue, and poor appetite. Urination and defecation were normal. She could not clearly distinguish fragrant smells from foul odors. The coating covering the tongue looked like mud and was yellow in color. The pulse at the wrist was thin like a thread, smooth but weak in force. The physician considered that the patient had been invaded by cold wind while excess heat had accumulated internally. Therefore, treatment was based on the classical formula Bai Hu Ji Zu Tung. Prescription: gypsum fibrosum, 50 grams, cinnamon twig, 5 grams, koix seed, 15 grams, Chinese yam, 15 grams, scutellaria root, 10 grams, ephedra herb, 3 grams, Houtunia herb, 20 grams, apricot seed, 10 grams, chrysanthemum flower, 10 grams, magnolia flower, 6 grams, honeysuckle flower, 15 grams, phoria, 15 grams, Pinellia rhizome, 10 grams, agastache herb, 10 grams. This was 1 day's dose. The herbs were decocted together in water, and the decoction was taken twice within 1 day. After taking the medicine for 5 days, the headache and nasal congestion were clearly relieved, and the turbid nasal discharge markedly decreased. However, fatigue and poor appetite remained. The doctor modified the prescription, removed scutellaria root, huangqin, added astragalus root, huangqi, 15 grams, atractylodes, baiju, 10 grams, and dried tangerine peel, chen pi, 10 grams. After continuing the medication for another 5 days, all symptoms basically disappeared. At a follow-up half a year later, the patient had no recurrence. Notes: Bai Hu Jia Gui Zhi Tang is the name of a classical herbal formula recorded in ancient Chinese medical literature. The patient's symptoms worsened when opening the eyes, bending forward, becoming fatigued, or in the afternoon. The physician did not explain the reason. Viewers may reflect on why these factors might aggravate the condition.